So I want to take some time to talk to you a little bit about complex breast surgery. What is complex breast surgery? Well, it's surgery where you've had maybe one breast surgery before in the past, or maybe two or three, and you're coming to me because you want to rejuvenate your breasts or get control back over your breasts again. Maybe you've had capsular contracture or a change in your breasts after your first surgery, and you'd like to have breasts that fit your body better, or maybe to deal with the problem that's going on with your previous breast augmentation. In my practice, I treat many women that have had maybe 2, 3, or even 4 breast surgeries in the past. These are complicated cases because we're dealing with complex healing on the inside, taking out an implant and maybe allowing a patient to go implant-free going forward, and also dealing with changes in the skin, location of the nipple, or the shape of the breast in general. So complex breast surgery is not something that you should just necessarily go into easily. You should definitely take some time to talk with your physician, talk about your goals, and to go over kind of the basics in terms of what your expectations are. I perform surgeries like these in my practice often because of my experience and my location, and because of the people that refer to me. But I like to think that many times I'm able to take a patient and say, this could really be the last surgery that you need. So we can, in cases where there's implants, remove implants, replace the volume with fat from your own body, and do a lift at the same time to really make breasts that fit your body that are also much more lower maintenance for the future going forward. Or in patients that have had implants for a long time, that are older patients that have a lifestyle change, giving them a surgical intervention to allow them to live a lifestyle that's more congruent with what they want. Or in patients that want to maintain implants but maybe want to downsize the implant or change the type of implant that they have to better fit their body. These are all great options and all great ideas for patients that have had their implants for 10 or 20 years, or for patients that have had, again, multiple breast surgeries and are coming for a revision of their lift or an improvement of the quality of their aesthetic result. It's not often that patients come in because they're unhappy with what they have. It's more likely that over time their results have changed, their bodies have changed, and now they're ready for another intervention to really get them back to the way things were before. So again, in my practice, complex breast surgery focuses around patients who've had several surgeries before, and they're looking for an opportunity to rejuvenate the breasts that they have, to remove the implants that are on the inside, or to deal with scar tissue around the implants, and to really give them control back over their bodies and a shape that matches their body. So, if you're considering complex breast surgery, take some time, meet with your physician, come meet with me and talk with me about some of your options for either removing your implants or just improving the overall shape of your breasts.